Okay, moving on. Last but not least, I would like to welcome our next speaker who came all the way from Washington, D.C. today from the Lung Cancer Alliance. I'm happy to welcome Lanni Boyd, who is the Associate Director of Stakeholder Relations at the Lung Cancer Alliance, and she's going to talk to us about updates and progress and how far we have come. So let's welcome Lanni.
All right. First of all, thank you so much for having me, NYU. Lung Cancer Alliance is always very pleased to accept an invitation to speak every year. We were trying to figure out how many years it's been. It's like nearly 10 that we've been a part of your program, so we really thank you for that. I also want to give a special shout out to Dr. Harvey Pass. He has been an advisor on our boards over the many years, and so I would be remiss to not do that. Louder, you got it. Not afraid to shout, I love it. I would also really like to thank the support group for being so brave and sharing your stories here this morning. I guess it was the morning when we started. I am not a makeup kind of girl, but I wore mascara this morning, and I was really regretting that decision when you guys were talking and sharing your story, so thank you for that. November is a really important month, as all of you guys are aware. It's not only important because it's a time to celebrate and raise awareness, and it's an exciting time to build community, but it also offers us a moment to reflect on how far we've come, and then also to look at how far we need to go. So a bit about Lung Cancer Alliance. I promise I won't be long. As some of you know, we are a nonprofit organization located in Washington, D.C., dedicated to providing support and advocacy for patients and their loved ones and those at risk. We empower a vibrant and caring community by helping people navigate the path of early diagnosis, treatment, and long-term survival. So to reach our goal of tripling survivors by the end of the decade, that's going to take a collaborative approach. We know that we can't do that alone. Our 4 key buckets at LCA are support services, awareness and engagement, science and research, and health policy. So in providing support, we ensure our community has current, credible information and the emotional support to make informed decisions to extend survival. Under raising awareness and engagement, we ignite national dialogue about the disease to educate the public, eliminate the stigma that some of you have touched on already today, and inspire action by a growing and compassionate and engaged community for change. Under enhancing science and research, this is a newer bucket for us since kind of 2015. We advance scientific discovery by contributing patient perspectives and insights into new treatments, collaborating on innovative studies with leading academic institutions like NYU, and connecting patients to clinical trials and research projects. And last but not least, we help shape health policy. So we lead national advocacy efforts by educating our elected leaders and government agencies to our community's priority needs, which are increasing research funding, expediting new treatment approvals, and improving access to high quality and affordable health care for all. This is a pretty blurry and really busy slide, and really the details don't matter. I just wanted to show you kind of how far we've come and some key milestones from when Lung Cancer Alliance was founded in 1995 in Washington State as All Case back then, if any of you heard of it then, and when we moved to DC in 2005, and kind of we're very proud to have played a major part in the way that we change how we support, talk about, and then ultimately detect and treat lung cancer. But really the important part of this slide is that none of these milestones would be possible without each and every one of you. So each of you in your own unique ways has really helped to elevate awareness about this disease, whether that's attending a support group, whether that's being here today, sharing your story on social media, talking to your neighbor, colleagues, family, and friends about the disease, really putting a face to lung cancer, participating in a clinical trial. All of those are each ways that you guys have helped grow this lung cancer movement, and you should be really proud of that. So to touch on a few things of where we are today, which a lot of the other physicians have talked about, today is an exciting time for lung cancer. Since 2015, low-dose CT screening for lung cancer has been covered by both CMS, so Medicare, Medicaid, and many private insurers for those at high risk for the disease. To date, the congressionally, in DC, we all use acronyms, you probably do the same in New York. The congressionally directed medical research program, so the CDMRP as part of the DoD, has granted a little over $113 million for research funding specifically for lung cancer, and we are fighting hard to protect that pipeline of funding. As other speakers have done a great job of explaining, there have been more treatments approved for lung cancer in the past 24 months than in the last 4 decades. Which is a really exciting time, giving patients more options and longer survival. Precision medicine is no longer in the future, very much like Dr. Gandhi's slide. We see precision medicine as here today. So many patients are getting the right treatment for them based on their individual tumor, which is very exciting. In DC and New York, I think that it's hard to remember that not everybody has access to such high-quality physicians and medical facilities like you guys have here in New York. And so for Lung Cancer Alliance, we deal with a lot of people in rural America as well. So we established a program called Lung Match to really help people get access to molecular testing as well as clinical trials, and to provide, based on their individual reports and testing to their comprehensive panel, really specific treatment options, whether that's approved therapies, off-label therapies, or clinical trials, for them to take those reports back and talk to their physicians about it. No matter where they're located, we feel they deserve that right to care. And healthcare reform, it's been a really interesting last year as part of the new administration, and we are determined to ensure access to high-quality, affordable healthcare for all lung cancer patients. And you can find us on Capitol Hill regularly. That's why we moved to DC 12 years ago. The squeaky wheel gets the grease, and we are not afraid to be squeaky. I've been at LCA for a little over 6 years, and in that time, I have really seen the stigma change. It is absolutely still there. However, in the summer of 2012, we launched an awareness campaign called No One Deserves to Die, and we've really seen the vernacular switch, especially on social media, that when people are posting regularly about the disease, people are using the words, "No one deserves this disease," period. So we've seen that kind of change. So to talk a little bit about the future, this Lung Cancer Awareness Month does feel a little bit different to me as kind of those exciting times of where we are today. I have had the opportunity to meet many, many incredible survivors and family members over the years, and we're honored to fight alongside you guys. It's true that more treatments have been approved in the last few years, and research is definitely ongoing, but we need more options and longer survival for our community. We also need widespread access to precision medicine. As I mentioned, everyone deserves the right to high-quality care and access to all of these new advances that many of the physicians have spoken about. We need greater patient input in study designs. Your voice matters. Researchers care. They want to know what's most important to you and what's most important to your daily lives and your family members as well. We need those at high risk to know about lung cancer screening. We need new innovative technologies, whether that is better liquid biopsies, whether that is improved. We have CT scans now for early detection, which is fantastic, but where is that going to be in 10 years? What's next? We need increased federal research funding, and we'll keep calling on Congress to treat lung cancer as a national public health priority, which it deserves. These are all places that we know we need to go, but none of these things are possible without you guys sharing your stories. So talking to your members of Congress, if you wanted to come to DC, we'd be happy to have you. The New York group is always our loudest and largest and best contingent when it comes to our annual summit every year. Some of you may have been before. We just had our summit in September, and the New York group was a force to be reckoned with. So I invite you guys to all come next year. Whether that's participating in clinical trials, educating your colleagues, your friends and family members during Lung Cancer Awareness Month and even beyond, whether that's hosting an event or attending things like today or joining your support group here. Without this, there wouldn't be a lung cancer movement. So I just wanted to thank you guys again. Know that you aren't alone. You have a great facility here supporting you, and know that we're not far away in DC fighting for you all as well with Congress and beyond. So thank you very much.